Hi, and welcome to Athletic Pursuits, the podcast that journeys all aspects of high school sports. I'm your host, Ben Schreiber, and I'm looking forward to diving into the realm of high school sports and athletics with you. We will explore all aspects of high school sports and athletics, including working out in a school environment, representing your school and a sports team, dealing with injuries, and more. We will discuss stories of people that demonstrate expertise or participate in these topics. We will discuss the good, the bad, and the truth behind what it's like to participate in athletics while maintaining the balance of being a full-time student. So get ready for a journey of fun and excitement. And without further ado, let's get straight into it. On today's episode, we have a special guest, Tomo Tanabe. She works at the nurse's office as an athletic trainer. Let's get started. So hi, how are you doing today?
Good, thank you.
So tell me a little about what you do at school.
Okay, so I work as an athletic trainer at Singapore American School. So my main role is helping athletes in our high school setting, whether it's preventing injuries or once they get injury, it could be managing those injuries,
Mm.
starting from evaluating the injury and then going through the whole rehab process. And the whole point is to keep the athletes safe. And then if they get injured, to return, have them return to sports as soon as possible, but as safe as possible.
Mm. So tell me a little about that rehab process.
Rehab process is obviously starts when the athlete unfortunately gets injured. People might think, oh, we just need to rest it and it'll get better, but actually it doesn't, and you need to go through pretty rigorous rehabilitation exercise for any kind of injuries.
Mm.
And obviously it would look different from injuries to injuries and the severity of the injury, and depending on the severity, it could be a week-long rehab, it could be weeks of rehab, it could be month of rehab, but obviously it's different to injuries.
It varies, right? Yeah.
Yeah.
So how often do you see a student come in with like physical pain or an injury?
Every day, someone walks through the door, they have an injury, whether it's from, it could be from PE or it could be from just daily activity. It could be an athlete. But yeah, the school this big, you definitely see some sort of injury every day.
Yeah, for sure. Like usually when I come in, I always see a couple of people there and I see some people like doing those rehab exercises and
Yeah. Yeah,
yeah.
yeah, yeah. Usually in the season, obviously, you probably unfortunately would have, few injured player throughout the season, right? So yeah, it does get busy in the office sometimes, yeah.
Yeah. Well, so what type of students do you see come in? Like, is it usually like a pretty bad injury or like something minor? Like what? Yeah.
Majority I would say is maybe ranging from, so injury can be mild, moderate, severe, and probably the most I see, I would say, is maybe mild to moderate. So, luckily, knock on wood, we don't see a severe injury that often. So I would say, yeah, I would say mild, moderate are the most common ones. And then obviously occasionally we might have severe injury like fracture or dislocation, a really bad, severe ankle sprain, or knee sprain. ACL would be a severe one, but
Yeah, those
yeah,
are
so yeah, we could have those severe ones, maybe 10 to 15 maybe per year.
mm, yeah, that's quite a lot. Like especially with such a
Yeah,
big
yeah, maybe more than you think. Yeah.
yeah,
Especially ankles, there are a lot of severe cases of ankle sprain. So, yeah,
yeah.
that ankle sprains are the most common ones, common injuries. Yeah, for sure.
Rolling the ankle.
Yeah, right. You see it all the time. Volleyball players stepping on other, player's foot under the net, or a basketball player, right, coming down from a layup and then landing on someone's foot, or right, just doing a lot of sideways movement and then roll their ankle. So yeah, it happens so often, actually. Yeah.
What I find kind of interesting is that the shoes I use when I play kind of are built in the way that prevents me from rolling the ankle.
Hmm.
'Cause I don't know, it's
Yeah,
strange
yeah,
because
yeah.
like sometimes I go like this, but then I can't roll it any further because like the way the shoe like it prevents me from doing that. because I wear like basketball shoes when I play volleyball, and
Okay, yeah.
I think it's intentional. I'm not entirely sure, but I feel like that's really useful, especially for like those type of sports, because it
Yeah,
can.
for sure. I mean, basketball definitely is so much like lateral movement. So yeah, ankle injuries are super common, and I think that's why basketball shoes are kind of made in that kind of certain design, like high tops, right, just to protect your ankle. So, yeah, I mean, I don't know if a lot of people use it as for volleyball, but it makes sense, right? Volleyball is also a lot of jumping, a lot of sideways movement
The
as
cord is
well.
the
So.
same. So like most people I know, like they either wear Asics or have a pair of basketball shoes. Yeah.
Yeah. Yeah. So yeah, definitely there's some shoes that you can choose to wear that might help you prevent those ankle injuries.
Mm. So do you see people come in for like gym related things? So maybe people that work out in the gym and then they maybe injure themselves or pains regarding just working out too hard or too strong or too much.
Yeah, we see, a lot of them come in, not most of the time, but some of the times it's just pure soreness, right? DOMS, right? They just get delayed onset muscle soreness. But sometimes when you're kind of new to working out, you might think, because it could be quite painful. So they might think, oh, did I really injure myself? So
Yeah.
obviously, that's my job to kind of differentiate. Is it just purely soreness, or is there something going on, like, something with a tendon or a muscle? Did you actually injure it, right? So
Yeah.
yeah, sometimes it could be just, oh, it's just soreness, don't worry, it'll be gone within 3-4 days or a week. Or sometimes it could be, actually, I think you might have strained, maybe your rotator cuff in your muscle in your shoulder, or like a biceps or back, right? So you kind of have to maybe slow down a bit, maybe do this exercise instead, and kind of, so give them some advice. But yeah, some people come in for sure from Apex.
The way I see it, I feel like it's a time kind of thing. Like if you feel random pain, like what I do personally is I always observe it a little bit. Like I'm like, okay, like my knee, I have a little pain when I walk up the stairs. Like I wonder where that's from. But then usually like after a day or two, it goes away. But I feel like if it's something more, like if it's longer or something just doesn't go away or gets worse, then I feel like that's something worth coming in for and
Yeah,
could
that's
could
actually a
prevent
great
it.
point, right? Yeah, because you might have some pain, and right, and you know your body best, right? So you can kind of see how it goes in a day or two. And like you're right, like usually most of the time, pains and aches and pains will go away within 2 days or so, right? So maybe if it lasts longer, definitely worth checking, right? Because if you just maybe ignore it and keep going, which happens a lot for the athletes, right? They just want to continue going. So they just want to keep going. So they think, oh, hopefully it'll just go away. And they keep playing and playing, playing. And sometimes, it gets so bad that they maybe have to be out for a longer time. Whereas maybe if they recognize their pain earlier and maybe done something about it, maybe it could have been, okay, you can continue with your sports, but maybe do this on the side, or maybe take a week off, so sometimes, yeah, I think you're right. I think you need to pay attention to your body and the pain, right? All the signals your body is giving you. And then obviously make a decision, right? Well, maybe I need to stop and go see, someone about it, or okay, actually it went away, it was okay. So yeah, I think that's a great point.
Yeah, I'm glad you brought that up with people waiting because I feel like people would be scared to come in to see like what could be wrong. Like I've been feeling that that's the type of thing that goes around where like, oh, I feel pain. I'm too scared to like go and see Tomo because he's gonna tell me that I can't play anymore. And
Yes, yeah, for sure. I think especially like in the season, or the stakes are high, especially like tryout season, or maybe getting close to IASIS.
yeah,
Definitely, I do recognize that. And yeah, I can see that athletes, going through that in their head. Or, if I go now, maybe she'll say, well, I can't play, but I actually really want to play this weekend to make my asses, whatever, right? So yeah, so I guess that's kind of my role, to educate athletes. Sometimes it's actually, you'll recover much faster if you take care of it earlier, right,
yeah.
than
I still be able
lingering.
to go to IASIS and
Yeah. And obviously, like, I do have to sometimes make a tough decision to say, actually, I know you want to play this tournament, but you physically cannot, right? And I know, that's not the news that they want to hear, but sometimes that's the best for them. So it can be tough sometimes, for sure.
yeah. But I feel like if you think about the long run, right? having an injury that you can recover is better than hurting yourself even more by still playing. Like if you really want to go to IASIS, but you have really bad, like, I don't know, like ankle injury or something, but then you just,
Hmm.
well, I'm just gonna play anyway. Like it's for IASIS, but then I don't know, it could be something permanent. I feel like that's kind of how it works. If you keep putting stress on an injury, it could like become like
Right.
problematic. Yeah.
Yeah, for sure. And sometimes, it could be permanent. And some injuries, you might be able to play through, right? And there might be some things obviously I can assist with, right? Whether you need to maybe do this exercise before you do it, or you need this kind of taping to help you. So, I mean, I will do my best to obviously have the athletes play through maybe some sort of injuries if it's safe, right?
Yeah.
So obviously, like you say, long term, um, disability, I don't want to cause anything long term, right? So that's always in my head. But as long as it's safe to play with some sort of injuries, you can, right? I mean, as an athlete, sometimes you have to play through a bit of pain.
Yeah,
So
of course, but
yeah,
it's really bad. I feel like you should think about more about your future, how you want to make a full
for
recovery.
sure.
You can live your
Yeah.
life without having that. Yeah.
Yeah, because after all, right, you guys are all in high school, right? So you could
Yeah.
still have more sporting career after high school. So, but I know in high school it's hard to think about the future when, you know, things like IASIS is right in front of you. So
Yeah.
I do understand that. Yeah.
Mm. So how, wait, what was I gonna say? So okay, wait, before I ask this question, I want to like, let's take a little bit of a, let's talk a little bit about taping. How does that work with like when you tape your arm? Because I've had friends tell me, oh, can you tape quickly? And then they like make me do specifically around here. And I've always
Right,
wondered
right,
how it
right.
works.
Yeah, so there's different ways of taping, obviously, and different tapes to use.
Yeah.
Uh, I mean, the main key for taping is supply stability. Okay, so whereas it's the shoulder or the ankle, there's something going on, whether it's tendonitis or instability, or the ligament is healing, so it's still unstable. So the tape was supposed to supplement that stability. Okay, so it
That's
acts
for
almost, you can
stability.
ask like a muscle or ligament just to keep the joint in place. Obviously,
Yeah.
it doesn't heal or cure anything. So it's just a supplement, right? So
Like
it's
a
not going to take away
stabilizer, right?
pain, but and then obviously there's a certain way to do it because you want to kind of support the joint in a certain way. So there's different ways to do it, but there are specific ways to do it for certain injuries.
Yeah.
Yeah, yeah.
Yeah.
But yeah, the goal is to provide stability usually. And then the KT tape is a bit special because it's has the same elasticity as the skin. So when you put it on the skin, it lifts up the skin a bit, create a little bit more space. And because there's a little bit more space, there's more blood flow. And then blood is usually good for any injuries because it brings nutrients, oxygen, and remove all the waste that's there. So another point for the KT tape and rock tape that you might have heard of
Yeah.
is actually increase the blood flow that promotes the healing. But
So
most of the time I use it for stability.
it pushes the skin or it like
It
compresses the
lifts when you
skin.
put it on, it lifts the skin up and then create a bit of space underneath. And then that
So it like
increases.
opens up space.
Yeah, yeah, yeah. Yeah.
I was
So
thinking
you
if I
can use
was
that for that. Yeah.
because I've heard of compression, which kind of does the opposite. Because but that's not
Yeah.
really
So,
for
yeah,
like I wonder because like when you bleed, you stop the blood flow by like wrapping like you've seen those movies
yeah,
where
yeah,
someone
yeah.
gets some
That's
like
because you want to
stab in the
stop the
arm and they like
bleeding.
wrap their shirt around their arm and like stop.
Yeah, that's right. Tourniquet, right? Yeah, yeah,
So
yeah.
there's
So
the
that's
other way.
one. Yeah. So that because you want to stop the bleeding, right? Obviously there's a wound, you want to stop the bleeding. But usually with an injury, blood, like I say, blood brings nutrients, oxygen, that's great for the healing. And then there's also going to be waste from all the injury. So you want to kind of remove that. So you just want increased blood flow to the injured area. So the KT tape is supposed to do that. Okay. But usually with an acute injury, when the injury happens, because of all the swelling, right?
Yeah.
Right, like all the damage to the ligament or the muscle, it usually swells up. So the compression initially is to just get the swelling down. So
Yeah.
usually
That
acutely
makes
you
sense.
want to compress just to squeeze the swelling out of the area. And then after a while, you can promote the blood flow just to increase the healing process. So I guess different techniques to use for different stages of the injury.
Okay.
Yeah.
So I heard the course AT kinesiology has a unit where you teach people how to tape. Is that true? And how does that work?
Yes. Yeah. So Dr. Bond invites me for just one class, but I go over like common sports injuries. And then at the end, we just want to give, the students opportunity to kind of feel how it feels to be taped and to tape someone.
Mm.
So I just usually would pick an ankle taping, and they practice how to do it. I think it's kind of cool to see how it feels with the taping. It's usually the feedback is, ooh, I don't know if I can run in it. It's quite tight actually. I don't know if you ever gotten your ankle tape,
I
but
I know I haven't personally I haven't.
no, yeah. So it does feel a bit restrictive, feels maybe a bit like a cast even. But again, it's to support the ligaments that's damaged, right? So obviously, if you do it on a healthy person, right, their ankle's perfectly fine, no instability, so you might not feel the benefit. But it's more for people that are recovering from an ankle injury. They're probably ready to go back to playing, so it just gives a bit of stability. So, but yeah, the class is kind of um teach the students that whatever they learn in kinesiology,
Mm.
some professions actually use that to daily work thing, right? So whatever they learn, the muscle names or the movements, I use those all the time. So it's really to show the students that what you're learning is actually being practical, and practical use for some professions. So
And I feel like as an athlete, knowing these things is really important. Like because like not everyone takes the class, but certain people that do, they would know like to have more information like on like identifying their own pains and being able to
mm.
like know how their leg gets taped or how they tape other people.
Yeah, right. And then I think if you have the skill, like especially if you play volleyball, right, you probably will run into someone that rolled their ankle. And
Yeah.
if you maybe done it a couple of times, you might be like, hey, I can actually help you, right? So I mean, it's a good skill to have. You do need to practice, but I think if you kind of get it once, you probably remember. So
Mm.
yeah, true. I think yeah, as an athlete, it might be a cool skill to have.
Okay, well, so tell me a little bit about your story. When did you start working in this field of athletic training and what drove your passion for it?
Um, yeah, I think initially when I was in high school, I was like, like all of you, like, oh, what do I want to do? Like, where do I want to study? And I think it was my father. Like, he was like, oh, I came across this cool profession. It's called athletic training, and I think you'll like it. So I really looked into it. And at the time, like you guys, I just loved playing sports. I loved watching sports as well,
Yeah.
but I also wanted to do something to help people. So this was like a perfect combination of, being involved in sports and also help people. So I was really intrigued and I decided to go and study that in the US. I lived in Japan then, so I decided to go overseas to the US to study. And I really just enjoyed it. I loved being at the sideline, watching all those games. And then obviously when I needed to do something, I loved doing hands-on stuff. Like I loved taping. I just loved all the parts of athletic training. So that's kind of how I started. And then I did a grad school in Phoenix, Arizona, did my master's in athletic training. And then I worked at all boys school in Phoenix, Arizona for 2 years. And then I came here. So, and then this is my 15th year at SAS.
15.
So I've been here for a very long time.
So you know
Yeah.
your ins and outs of everything here, yeah.
Yeah, at SAS for sure.
Mhm. Well, let's see. So we've been talking a lot about rehab, right? But what about prehab, where you do things that prevent you from getting injured, like strengthening knee muscles or something like that? How important do you think that is for an athlete? And do you recommend most athletes do it?
Yeah, so I think you said initially like maybe athletes are kind of scared to come in to
Mm.
see me because they don't want to miss out on playing. So I think prehab is a perfect kind of a solution, right? If you do prehab, you want to do prehab to kind of avoid the rehab right after you get injured. So I mean I think it's I it's super important for athletes to be proactive about their body, right? So getting themselves ready, getting the body ready for the whole season and throughout the season and even before the season, right? So prehab does play a big role in just preparing your body and addressing the things that you might have issues, right? So there's not one prehab that everybody can do. I think it needs to be obviously tailored to individual needs. People have different needs or different issues or different things they need to work on. Uh, but just, having a routine of some sort of exercise, prehab exercise, I think helps to reduce a lot of the injuries, right? And I mean, if you can go through the season without getting injured, that means you can focus just on getting on better at your sports, right? So I think in that sense, yeah, prehab is kind of a great solution, right? To have a successful season for our athletes, for sure.
So when you said it's tailored to individual people, do you mean in terms of people that might have like certain problems with like a part of their body that could cause them to be more prone to injuries, or does it depend on the sport they play?
Both, right? So different sports have different demands. So depending, if you're a cross country runner, and then if you're a soccer player, or if you're a basketball player, volleyball player, right? Just the knees, the things that your body has to do in that sports are different. So obviously you want to kind of tailor it to the sports, and you want to kind of, mimic the movement that you would do in that sports, right? For the exercises. And then, like you say, the individual have different issues, right? Some might have some ankle limitation in their range of motion, or some might have a previous knee injury, so they might have certain, they might need to work on a bit more on knee stability.
Mm.
Cross country, soccer, they probably don't have to work so much on the upper body, but if you're a volleyball player or a basketball player, right, you probably want to work on your shoulder, maybe on your lumbar thoracic spine. So I think in that sense, right, you just want to, and then some people have, different posture as well, right? So if you want to kind of address posture as well, because that plays a big role, right? How you stand and how your body is, right, affects how you play as well. So I think in that sense, it just needs to be individualized. So you could probably have like a kind of a basic, and then maybe, depending on the sports and depending on the individual needs, you could probably add few, take away few, and kind of, tailor it, I think.
Mm. But would strengthening the muscles around those possible injury points be good? Because that's what I heard. Like, for example, in volleyball, knees is a big thing, injuring the knees or having, I don't know, tendonitis or something else happen to your knees.
Mm.
But then before you'd hit legs in the gym a lot and like do those certain exercises that strengthen those muscles around. Like, I've heard that
Mhm.
like, really good way to like get yourself ready for a season or something.
Yeah, I mean, yeah, getting the parts that you use a lot in that sports is definitely, right? So volleyball, basketball, if you're going to do a lot of jumping, you want your knee strong. You probably also want your ankle strong, right? It's all connected, right? So if you don't have a good ankle stability, that maybe good knee stability though, right? But you'll always be wobbly because your ankle is kind of all over the place. That could end up causing knee pain as well. So you do kind of need to address your whole body, but definitely if for volleyball and basketball players, you do want to get your knee strong, your hips strong, right? So those will definitely benefit you to kind of go through the season without major injuries.
Yeah.
But yeah, I think maybe, it's especially for a season, it's hard because everybody comes back from summer, right? So, not many people might have access to gym, right? How do you think you're gonna get ready for a season one volleyball?
Well, of course, right now I'm working on just training, getting better at the sport to make sure I make the team and everything. And then of
Mm-hmm.
course, for the summer, right? I think I'm spending most of my time in Singapore. So of
Hmm.
course I'll try and train when I can. I'm not entirely sure yet because Singapore is very limited for volleyball, but I'm
Right.
thinking of like trying to gym as much as I can to strengthen the muscles and to just
Hmm.
physically be ready to, in case I do make the team 5 times a week training and then IAS's games
Yeah.
and everything, and like putting my body through a lot, which is probably not used to.
Right, right, right. Yeah, for sure. I think, yeah, preseason is also when you want to hit the gym, right? So I'd say if you're in Singapore, you probably want to hit the weight room, get strong, right? I mean, you don't need to be lifting heavy, but you need to be able to do kind of the basic athletic movement, right? With some weights, and then that should transfer into volleyball as well. Right? So
Yeah, definitely. That was my plan.
yeah.
Okay, well, thank you for your time.
Oh yeah, no problem.
I think we learned a lot of new insightful information about prehab, rehab, injuries, and how it affects our school and teenagers that do athletics. Yeah.
Cool. All right. I hope I answered all your questions.
Yeah, you did. I hope you guys enjoyed today's episode. I hope you learned something and have a little better understanding of student athletes dealing with injuries, rehab, and prehab. I have linked a form down in the description where you can leave me some feedback, recommendations, and questions. See you all next time. Take care.